let us get into the topic of plastic surgery in Korea, which I think is a bit of a hot topic. A lot of people are very interested to know more. And I think we really should start, first of all, with how the approach to plastic surgery in Korea differs from the West and also from what people might expect in the West as well. I think that's an important place to start, probably.
Yes. So what we always tell our clients who are interested in plastic surgery in Korea is that it is a whole different mindset. So again, it goes back to the culture of Korea. So culturally, plastic surgery is widely accepted. It is very common to see people with a bandaged face walking around the street as if, nothing happened, and nobody will flinch. So it is just an accepted part of the culture that people will do things, undergo surgery to change their appearance. And unfortunately, looks are valued in Korea, so that is probably why there is such, it's a cavalier attitude towards plastic surgery. So compared to the States, where it is not as common, and it really is a big undertaking, especially because the costs as well associated with it. There is also liabilities. There's a lot of litigation that could occur within the States. So doctors are more protected and they're more conservative when performing surgeries. Now in Korea, because there is higher demand and the cost, because of higher demand and the proliferation of a lot of plastic surgery clinics, the cost has come down. So there's a far less barrier to entry for people who want to get surgeries. So for one, a lot of clients will go to Korea because the cost is cheaper. Now, coming with that is the fact that surgery is not as, it's not a decision that people take months to kind of think about and discuss and with their doctors, and they don't do as much, research behind those procedures. In Korea, they will go to somebody that's referred by a friend, or a friend has done that procedure with a doctor. So I think they have a more casual approach to surgery. So when you go to Korea, the doctors, you may expect a certain type of environment to have a surgery in, whereas in the States you will see a big operating room. You envision an operating table with big lights over you and lots of nurses and just a more sterile a surgical environment. But in Korea, sometimes the rooms may look like a room that you get Botox in the States, or just a dermatology, an office where you get an exam or something like that. Sometimes it's just a small room. There's a table and there are surgical equipment, there's lights above, but that type of, less, maybe a serious type of environment sometimes catches people off guard because they think that
they're expecting like George Clooney.
Yes. But there's, sometimes just an anesthesiologist and a nurse next to you. Whereas sometimes there's a big team of nurses and doctors within that operating room when you're undergoing surgery in the States. So I think that catches people off guard, as well as, with facelifts, for instance, in the States, you may stay overnight and you'll get aftercare, and there's going to be a lot of nurses taking care of you right after. In Korea, in a lot of cases, you will get a facelift and you will go right home after. And they will teach you, they will tell you what to do. And all the aftercare is, the onus is on you. So I think maybe because there's a higher pain tolerance for Koreans versus foreigners, you're just expected to either take care of yourself or just know that go to the local pharmacy and ask for pain meds or things like that. It's more hands off in Korea versus in the States. So that is where we come in, and we do hold your hand throughout the entire process, knowing that a lot of clients will be taken aback by the more casual approach to surgery. So we want to make sure that what to expect first visually with the operating room, and who will be in there with you, what type of what type of results or things to expect after the surgery, whether there's going to be bleeding or bruising. Sometimes that is not explained because I think people just know if you get, eye surgery or blepharoplasties, you're going to get bruising and it'll swell. And I think they've just seen so many people go through that surgery that it's already, common knowledge to some extent. Whereas people traveling abroad who haven't seen people with bandaged faces walking around or noses, and they haven't seen those effects, they just don't know what to expect. And because that's not
Right.
always fully explained to you by the doctor or the nurses, we are there to just explain, this is what you can expect to look like the first day after, a few days after, and we can show you the results. Either, the doctor will provide the pictures, or sometimes if clients are willing to share, they'll show their before and after pictures as well. So just setting expectations, knowledge of, how to treat certain, side effects if they arise. I think we can provide that type of information and care for our clients if they choose to go surgery in Korea.
I guess that's the whole reason that a service like yours, a company like yours, exists in the first place, is because it is just that lack of maybe cultural understanding. Like, you really need a bridge there to sort of explain all of that and make it a little bit less scary. It would be a huge thing, for patients thinking about this kind of thing, flying in from overseas, not speaking the language. I'm assuming a lot of your clients have never even been to Korea before, and then they land to go into this really unfamiliar surgical environment. I can imagine that having someone like your team on hand to step you through that whole process and be there and translate and explain all of this can just lower the anxiety levels a little bit.
Yes. Just somebody
Definitely.
to just sit next to you and just provide comfort just by having somebody there, knowing that somebody will be there when you wake up from being sedated to take you home. Even though, there's plenty of people in Korea, you just wake up and then you just take a cab home. That's common as well. But you don't want to do that in a foreign country where you don't speak the language. Our doctors do speak English. Some of them are not completely fluent, but they are proficient. But we still do have a translator, because you don't want any medical advice or anything medically, especially involving surgery, to fall through the cracks and for there to be anything lost in translation.
100%. One of the things that shocked me the most when I had to go into hospital years ago now for a kidney biopsy, and in the Western system there would be a nurse there that comes and helps to do everything, and there doesn't exist that same concept. There are obviously nurses in Korea, but you need a carer with you to come and do all of that, like even to change your bedpans and everything.
Yes.
Which, a lot of foreigners would be really sort of shocked, like, what do you mean? Like, nurses don't do that. But they're there to more do things like, administer injections, check your, blood pressure and that sort of thing. But like the actual caring for you after the procedure is usually done by like your family.
Yes.
Or sometimes Koreans will hire a person to do that. If their family, maybe they live in the provinces and they're having surgery in Seoul, they can't, be there every day. You actually need to hire someone to play that role for you. Yeah, so it is just a little bit of a different way of doing things in Korea, I think.
Yes. Well, just to add also, even after big surgeries, Koreans are used to just getting back to work, just getting out and about and resuming their daily lives. So doctors do encourage that movement, but also it's just, you get surgery and then for the most part, even with a full facelift, you're able to get back to daily life even the next day. Whereas in the States, you do take maybe a week or so just to recover from the swelling or to just get some R&R, which you definitely do need. But I think it's a different mentality. Maybe it's the fact that they are just, they just are eager and are busy, and it's just
there's not as much annual leave either, I guess, is the other thing. Like, we really in Korea only get the 2 weeks, and then if you can manage to, I guess, book time over maybe, Chuseok or maybe Seollal or something like that, maybe you can have a little bit longer. But I think that's the other thing a lot of people don't realize in Korea. There's not much time off work, which I know can be a problem in the States for some people. But yeah, in Korea, we get a lot of public holidays to make up for it, but not a lot of annual leave.
And there's not embarrassment over getting anything done either. So you can go to work with sutures or swollen eyelids, and it's just the norm sometimes. So
Yeah,
there's no
I mean,
embarrassment over that.
I know people in my network that have rocked up with, the whole face done, and everyone's just like, awesome, what are we looking at here? Like, what did you get done?
Right.
And then a week later, everyone's like, wow, that's looking really good.
Yes,
It's
yes.
not like taboo or anything like that, whereas you would imagine, in a lot of other countries, people would, maybe not want people to see that part of it. But I think it's a
Right.
combination of the fact that people don't have a lot of time off work, but by the same token, it's not like some big hidden secret, like I think the statistics kind of show how the percentage of people in Korea that have these kind of things done. Like chances are if you haven't done it, someone in your family has, definitely people at your
100% yes.
school or whatnot for sure have. Yeah. Very different mentality. I guess that brings me to my next question, which is, what are the procedures for plastic surgery that your international clients are mainly interested in, or what are you seeing in your line of work for the foreigners?
So many of our clients are in their 40s or 50s or even late 30s. So we do have an older clientele, and the bulk of them are interested in eye procedures, eye surgeries. So whether it be a blepharoplasty or under eye fat repositioning or fat grafting around the eye region. The eyes are, I would say, maybe 80% of the surgeries that we assist clients with. The other thing is the jaws, lipolysis. I know lipolysis is non-surgical, but liposuction does fall into the surgery category. So liposuction is a common surgical procedure. I would say those two, not so much the nose or the jaws, but definitely the eyes, and then jaw sculpting via liposuction or the abdomen. Those two procedures are by far the most popular.
Very interesting. And that is quite different also from the kinds of things that Koreans are doing. Like, I'm pretty sure by statistics, the most popular are eyes and nose, I'm pretty sure in Korea. Yes. Yeah. I mean, I guess age has a lot to do with it as well. And by eye surgery, I don't mean like blepharoplasty. I mean like the double eyelid surgery.
Yes.
Which is very, very common in Korea. A lot of Westerners are like, what do you mean by that? And it's basically a surgery. You can probably describe it in better detail than I can, but to create a second eyelid, which doesn't naturally occur in all Asians. Yeah.
Yes.
A lot of people, when I point it out to them, they're like, I've never even realized that was a thing. Like, Westerners don't kind of clock it. They're like, what do you mean?
Well,
and I'm like, well, we have a double eyelid. Now, what?
Yes, I know. So it's so funny. Yes, it's something that you just kind of take for granted if you're not Asian, and it's a very popular surgery that it started because they wanted to make their eyes look bigger. So by lifting the eyelid a little bit, it will make your eyes look bigger and more Western or more awake, and that was the genesis of this surgery. But now the bulk of the population has had it done or is planning to, and this starts from a young age, sometimes teenagers, all the way up to the 70s and 80s, who need to use the incisional method to get rid of excess sagging skin. So it really spans generations, this surgery. That's why there's such a high demand for it, and there's so many doctors that do this procedure, is because most of the population is not born with it, so they will get it, or if they have it, then as you get older, you need a revision, or you need to use the incisional method to, assist in the vision. So as you get older, it will sag, and then it will limit your peripheral vision to some extent. So that's why a lot of the older generation will get this surgery as well. So that comprises the majority of the population of Korea that will have this surgery at some point in their life.
Definitely. Look, as far as I can tell, you can always kind of tell too, like, this is, I don't mean this in a mean way, but if you see someone walking along with their kids, and both of the parents have double eyelids and none of the kids do, like, that's always a little bit of a tell.
Of course.
Maybe, yeah, maybe something has happened there. That is absolutely fascinating. So I guess the other thing that you are the expert in is, sometimes people talk about factory clinics in Korea. I guess, what are the differences between these kind of clinics versus like the long-standing specialty clinics? And if people, for whatever reason, aren't able to use your services, which obviously I feel like we've just heard all the reasons why they definitely should go through an agency like yours, you know, to tap into your expertise. But if for whatever reason our listeners, you know, can't do that, what should they be aware of when they're choosing a provider? Like, how can you be careful who you are choosing?
Yes, that is a great question. And I think, of course, safety is paramount when you're going, not even abroad, even within your own country. When you find a provider, try to look for a provider and do your own research, safety is paramount. So that is, you know, a bigger consideration in Korea because you just don't know the landscape. You don't know where to start. So when you mentioned factory clinics, so I'll just start off by explaining what that means. Basically, there are clinics where there are multiple doctors. So you will go there. Sometimes you'll pick a number and then they will call your number and you kind of meet with a consultant there or a client manager there, and they will go through your concerns, anything that you'd like to get done or address, and then they will refer you to a doctor. So you are really just one amongst, you know, hundreds or thousands sometimes going to that clinic a day. And all the doctors are qualified. Often they are dermatologists who will be doing the procedures, but there is no, it's not I guess, a place where they will really get to know you. They probably will not, they have a record of you, but will not provide any aftercare in terms of follow-ups to ask how you're doing. They may not spend too much time with you during the consultation. So it is really kind of just a one-time transaction, and then that's it. So with these clinics, I think it's fine. I think you can have good results. There's thousands of clinics in Korea that you can get great results at. However, I think that what we can provide with our partners and what other travelers from abroad can maybe look for if they're not able to use our service or other concierge services similar to us is really sit down, have an opportunity to sit down with a doctor. So when you go to a clinic, let's say, even if it is a factory clinic, just ensure that the doctor will take the time to listen to all your concerns and really make a personal recommendation for your skin. So assessing your own skin type, making sure that whatever your concerns are addressed by what treatments that he recommends or she recommends, and that they are appropriate for you specifically. You don't want to get treatments that the general public or anybody can get. Often I'll hear that people go abroad and get the pico laser and get, you know, this type of laser, and those types of lasers you need at least 5 to 10 rounds to see much of a difference. If they recommend 1 round of pico, for instance, yes, that maybe that'll benefit, but you're really throwing money down the drain because you're not going to see much of a result from that. So there's doctors who will recommend just blanket treatments that will be good, and they just want to recommend something, but it may not be optimal in terms of the best bang for your buck for that type of treatment. So I think what you really have to do when you go abroad and try to find a doctor or clinic is trust your intuition. And is this doctor really understanding what I am saying and really recommending things in my best interest versus a cookie cutter type of treatment that can be applied to anybody, like my friend who may be traveling with me. So I think that is, it's a little hard because you do have to get to know and be willing to spend time with a doctor. The other thing with factory clinics is sometimes you may feel rushed because there are many people behind you. So they may just be ready to just move on to the next person. You want to be comfortable with the fact that that doctor is willing to spend as much time with you as you need, and to not feel rushed, and to explain in detail. You should ask a lot of questions if they're recommending a certain treatment. What is the downtime? What are the risks? What are some other treatments that you would recommend if I'm not comfortable with this treatment? So come armed with the right types of questions to ask, and we assist with that as well. So, sometimes cheaper is not necessarily better. You do pay up for quality. People think that treatments are cheaper there on a relative basis compared to the States versus Korea. But there are clinics who are relatively more expensive even within Korea. And you do often get what you pay for. So those clinics that do charge a premium are because the doctor is renowned in their field for that type of treatment. And there are many doctors within our network who are renowned and often have training sessions internationally for their expertise and their technique. And I definitely will pay a premium for their services. Our clients are willing to pay a premium for their services too. So you do get what you pay for. If things are too cheap, I think that is a red flag for sure. And I'll just give you an example. So when they say Botox is only $50 for your face or for a certain part of the body, that is misleading to some extent, because Botox, yes, it may be $50, but are they using German Botox? Are they using Korean Botox? Are they using Allergan's Botox? There's many different types of Botox that you want to ask about, and exactly what type of Botox are you using. Sometimes the Korean Botox is not as long lasting as the Allergan Botox. Xeomin, I always recommend Xeomin for our clients because it is the type of Botox that where you don't have the risk of developing resistance to. Now, all the other forms
is that the one that one of the Jonas Brothers is the model for?
I think Christina Aguilera has been in the past. Gwyneth Paltrow. I'm not sure if the Jonas Brothers was.
I thought that was a Jonas Brother, because that name, I'm like, that's a familiar name. Anyway, we'll move on.
I can find out for you. But Xeomin, it's a German product, and they don't have any extra proteins within that product, so that you will not develop a resistance to it. And if you're planning to get Botox treatments for the near foreseeable future, so many years, it is just safer to get the Xeomin injected versus others, and not all hospitals will have that. So if you were to see an advertising for maybe $50 for Botox and they don't have it, it's because they probably are using the Korean Botox or other types of Botox. The other thing is Botox is mixed. So when you're diluting that Botox, maybe they will just dilute it a little more and say, it's so cheap, but it's not really the concentrated form or the correct dosage that you should be injecting it into the skin. So these are questions that you should be asking. And for safety as well, they should be opening the package in front of you. So when I go to our partners, they show you this is Xeomin, and they're opening the box. So it's a brand new vial. And you should ask for that as well. Can you open this, whatever treatment that you're getting, this booster or this Botox or this filler? Can you open it in front of me?
Okay. That's excellent advice. I feel like you've already answered my next question, which was how can you tell if the clinic is high quality and safe? All of the things that you just said, I assume, go into proving that the clinic, number one, is safe, but also that it's on a little bit of a different level. And there are, for want of a better word, I guess, factory style skin clinics as well that are sort of just pushing through, lots and lots of people. And, depending on where the clinic is located, like if it's in a student area or a university area, they're fine with the $50 Botox because they probably can't afford any more than that. But, if you're flying all the way from overseas, then maybe you want to pay up a little bit and have a little bit of a nicer experience too, where you're not just like in a room of 20, students lining up to get stuff done. Yeah. Very, very useful tips. I feel like we've already sort of answered the question about the difference between what locals prioritize in a clinic versus what foreign patients need. I mean, it is all of these kind of things. I think there's a bit of a deeper understanding of locals too about what they're getting, so they don't go in maybe with I guess if you're a foreigner coming in for the very first time, you don't really know what to expect, whereas Koreans understand that there are differences. Different levels.
Yes, and they see their friends or their family getting these treatments and they see the results. So when foreigners fly in, they don't have that luxury of having their circle of friends or their network, having had certain treatments and seeing the results firsthand. So at that point, you're really trusting the doctor and what they're saying in terms of the results that these treatments can achieve. But the locals, they have a relationship with their local dermatologists as well. So, there are dermatologists on every block, it seems, and when you're in a neighborhood, you just go to the neighborhood dermatologist and they have a relationship with them and they know their skin. So it's just a part of daily life. I think that is a difference, and it's a cumulative, just a gradual progression in terms of treatments on how to achieve the type of skin that your goal is to achieve. And it's slow and gradual, and they'll do different treatments every week or every month. Whereas for foreigners, you're going in and you want to jam pack as much as you can for the best results in a shorter period of time. So it's a different mentality and a different, I guess, cultural approach to how what they look for in skincare.
And I think that's essentially the other thing that your service is providing. It is providing that and you don't have that network of friends and family, but you do have all of your clients, and that's really what you're gaining access to, and all of the things that they've said about their experience and whatnot. Clients can get that from using a concierge service, which is a big value add when you're flying to a foreign country where you don't know anybody.
Yes, and then I think what we also try to tell our clients is that, yes, you can spend $1,000 on a certain treatment, but do you really want to spend $1,000 for something that will last a month or even a couple months? Or if you're really looking for longevity, then maybe try this treatment versus another. And so I think there's value in that, such that you're not, I don't think that doctors are necessarily... Yes, or always honest in terms of, what is really worth your money. And I think that is what people value, is like, if I'm going all the way abroad, I want to do as many treatments as possible, but is it really worth my money to get this in addition to it if it's just going to last a few months? And if you're not going to see that big of a difference. So sometimes doctors will say this will boost your skin, this will, result in, supernatural glow. But those are unrealistic expectations, and we try to temper those expectations with our clients, because, sometimes you won't see those results and you'll spend almost $1,000 on a treatment. So there is that point of reference that we can provide. Very,
very, very useful to add that in as well. So look, I had a couple of questions around tips for medical tourists, but I really feel like we've answered all of them. We've answered the advice that we would give to people, the biggest misconceptions, red flags as well. I feel like you've mentioned a lot of them. Is there anything else that you can think of that would be like a red flag for a foreign patient?
I think red flags, like I mentioned, is if the doctor is not willing to take the time to really spend time understanding your concerns, if you feel rushed in any way, if they're not willing to answer all of your questions regarding treatments, if they just kind of brush you off. I think I've heard that in the past. It really comes down to the doctor, because that is a person who's administering the treatments. And you really have to trust that person, trust those qualifications, make sure that their qualifications are online or you can access them somehow, their board certification, or if there's published research that they've published in the past. And reputationally, it's really hard to gauge a doctor's reputation as a foreigner. I think just being in that network, understanding what dermatology groups or associations they're a part of, whether you see them training other international doctors that fly in, things like that, we have knowledge of. So that is another reason how we pick our clients, or our partners. But for people who are flying in from abroad, I think you really have to be comfortable with that doctor's qualifications. So if there's a lack of knowledge of that, or if you're not able to find information, if they're not willing to disclose that, then I would say that's a red flag. And to just find somebody else who's willing to be more open, because, what reason is there to not be open? A doctor should be willing to share their qualifications and talk about the research that they've published, any patents that they have, any proprietary devices or treatments that they've developed.
Right. That's very, very, very good advice. Yes. I feel like sometimes there might be, if you've flown all that way there and you had a certain person in mind, maybe if you're sitting in front of them and you do get a little bit of a bad feeling, you might be like, oh, well, I've come all this way. I don't want to, throw all this time and effort out the window. But keeping all of that in the back of your mind, and I guess that is the other good thing about Korea is if you don't like the doctor sitting in front of you, there are plenty more down the street. You're not really limited.
On the floor above.
Exactly. Just ride the elevator a few floors up, you'll find someone else. All right. We did have a couple of listener questions. So I guess if you're okay for time, we might attempt to answer some of them. Now, look, I apologize to this. We did have a laundry list, really, of questions that came through, and we just can't really get through them all in one episode. So I've just picked two. So if your question wasn't picked as one of them, that's my fault. I apologize in advance, but I was just trying to get the list down a little bit because it's quite long. So the first one is, what is the Korean aesthetics approach to lower eyelid correction, especially for issues like bags, laxity, and volume loss? And can you walk us through both surgical and non-surgical options?
Yes. So again, the eye area is a surgery or a region that is in high demand in terms of surgery. However, there's a lot of clients that we have who want to address shadowing or dark circles. So it's very common. I'll start with the surgical. The surgical method is, unfortunately, it is usually the cheaper method. So it's much cheaper to get surgery versus non-surgical treatments. Now, I would say, it could range from maybe $1,000 to $3,000, depending on whether you get fat grafting in addition to it. But that's a general range, I would say, in terms of dollars. So you can do fat repositioning. Sometimes in older clients, they may need to use an incisional method where they do cut some of the excess skin and lift the skin and then just do the stitching along the lower lash line. That is a surgical procedure.
And is that like visible on the outside, or they do within the eye?
Literally right on the lash where your lower eyelashes are. So that is where the stitches would go. And I've seen it done. You cannot tell at all. Maybe the person who has the surgery is able to see a little bit, but that the stitches heal beautifully, so you can't see the incision there. So that is one method of getting the under eye addressed. The other method is fat grafting. So if you do not need to cut any skin, if you don't need any lifting necessarily, under eye fat grafts as well as fat repositioning is another way. Again, stem cells with the fat graft is the most effective. It offers the most longevity. So that is a treatment or surgery that is growing in popularity. Now, in terms of non-surgical, there are several options. You can use Regeron Eye, which is the booster treatment that you get injected into your skin. However, there's an eye version. So with that, it provides a little more, so the under eye area is very thin. The skin is very thin. So the reason that you will see dark circles or just darkness under there is because the skin is so thin that you do see the blood vessels. And
that's my problem.
Yes, so for many people, if you just add another layer of a serum or the solution under the eye, there is a little more thickness to that area, and it provides a little less, color that is visible. So Regeron Eye is a popular procedure. There's very little downtime, maybe some bruising, but they will inject that solution under the eye. That is one. Another solution is filler. Or collagen biostimulants. So filler, you can see the results immediately. A lot of people who have done filler in the under eye in the past have had either migration or have had some side effects and they're not happy with it. But this is where technique is key. So with filler, because you see results, because there's a risk of migration and misplacement, you really have to go to an expert who is just doing filler all day long for years and years and with decades of experience. And these are some of our partners. They have extensive experience in clinical trials. They do many training sessions for international doctors. So when you're doing the under eye area, precision and technique is paramount. So it is definitely addressable with filler, but I would not just go to anybody. Like I do not go to any person in the States. I only go to one person in Korea for my under eye filler. I haven't done it in years. It does last for about 2 years. That is one option. There's also biostimulants, collagen biostimulants, which is Sculptra,
like Sculptra, yeah,
or Jubiluk, and you inject it under the eye, and it creates volume, but then it gets absorbed into the skin over the period of a month or two. The collagen will start to develop and grow under the skin and increase the skin thickness. So that is another reason why that it'll seem lighter or brighter, is because you're not, the skin is thicker there. So those are 3 common ways of non-surgical ways of addressing under eye dark circles or shadows. And it really depends on your anatomy. So another thing you have to think about is your anatomy and your the fat deposits under your eye is all different. And just because your friend has had this type of treatment does not mean that same result will you'll achieve the same result with that treatment. So the doctor, the selection of the doctor, and assessing your specific bone structure and your anatomy is really important to diagnose or to recommend the appropriate treatment.
Excellent. I feel like you've given our listeners some excellent advice there. So, get on the phone to Jennifer, I think, if you need to sort this one out, because it sounds like there's a lot of different things that you need to take into account as well, which as a layperson, you're not really going to be able to figure that out. So that is excellent advice. Thank you very much. Now, our next question is a little bit of a funny one. And our listener was asking, what is the likelihood of your face caving in years after jaw shaving surgery? Can you shed some light on the long-term risks of this procedure?
This is such a funny question, because I'm
not sure if she's 100% serious about this, but let's answer it as though it is.
Yes. Okay. So, in terms of your face caving in, I believe maybe that would be related to bone loss in the jaw area over the years. That is true. So the bone density, or the bones do lose form and structure as you age. So let's say in the sense of if you have dental implants, or when you lose teeth, you do lose structure and your bones do deteriorate over time. So that is something that can feasibly happen. However, when you're getting your jaws shaved, which is a pretty common surgery as well in Korea to kind of slim your face and to make it look more feminine. This goes back to the doctor selection. You really have to make sure that the doctor you select is truly an expert in that type of surgery. And if you do get into the wrong hands and they do a surgery that, shaves off too much, for instance, maybe potentially down the line, it could happen that your face will cave in, but highly unlikely. You do, with all surgery, have to pick the right doctor, the right surgeon, and make sure that their credentials are impeccable, that they have had a long history, at least 10 to 15 years of doing this type of jaw surgery, so that you have patient cases to look back from 15 years post-surgery. So, again,
this is not the kind of surgery that anyone should take lightly either.
Yes.
So I feel like of all the Korean surgeries, this one is probably like on the more serious end of the spectrum in terms of complications, recovery, all of that kind of thing. Even if caving in is maybe not the most realistic outcome, I feel like you definitely want to be doing your homework on something like that before you walk into the doctor's office.
However, even if you do go to an expert in this sector and you do get the surgery, I think one of the side effects that clients do experience is that there is some jowling that can that can happen.
Right.
So because you're not cutting off the skin in that area, you still have the skin there, but you don't have that bone holding up the skin. So you do have skin laxity that can occur. So a lot of the popular treatments that, well, what you pair up with that surgery is skin tightening treatments. So you do maybe Ulthera, or you do a Thermage that will help increase the elasticity of that skin so it won't cause as much jowling or sagginess. So those are just some things to take into consideration if you do consider the jaw surgery.
I didn't understand whether she was actually considering it for herself or whether this is just like statistically speaking.
Yes.
So I hope that answered your question, and thank you very much for that explanation. That was great. Jennifer, we could sit here and talk about this all day, and I'm sure our listeners, if they had a chance, would just pepper you with even more questions. But this has been absolutely fascinating to get your insights. I feel like you have such a unique perspective because obviously being Korean yourself, but then, helping so many Western clients access this. You've really seen sort of both sides of it. So you've got all the industry insider information on the Korean side, but you know so much about what what foreign patients are really worried about, what procedures that they want to get. So thank you so much for sharing your valuable insights, your time with all of our listeners today. If people want to find out more about how they can work with you, how they can avail themselves of all of your knowledge, where can they find you?
So, well, first of all, thank you so much for having me on this podcast. This was a blast. I just love talking about this industry because there's so much demand right now, but I do want to ensure that people are going abroad safely. And I just want to educate as many people as possible on how to safely get effective treatments that will last, months or years and achieve the results that they're going abroad for. So
more importantly,
yes. So if you do want to work with us, or if you're interested in learning about our services, our website is Anew Concierge, ANEUE concierge.com, and feel free to inquire and set up a free consultation with one of our managers or myself. You can also go on our Instagram and DM us. It's Anew Concierge. That is our ID, ANEUE Concierge.
We'll have all the links below in the show notes as well for anyone listening along. If you're watching on YouTube, I'll have all of the links in the description, so you don't need to write any of this down. Just go click through to the show notes and I'll pop all of these down as well.
Yes. Well, this was a pleasure. So much fun. We can talk for hours on this. It's so it's a great topic. It's a very hot topic right now. So
it is.
I'm happy to be on.
Thank you so much. Well, we might wrap it up here. For all of our regular listeners, thank you so much for tuning in. I will be back in your ears shortly with another roundup of the latest news and current affairs, everything that's happening in the world of K-beauty. So make sure that you do say subscribed if you're following along on YouTube, or click the follow button if you are listening in your favorite podcast app. Until next time, I will see you on stylestory.com.au and jellico.com.